You're sitting there alone in the back of the ambulance. You have a patient on the gurney that starts looking at you and starts making odd movements. And all of a sudden they get up and they start screaming and swearing. And they start throwing hands. And they start going crazy and ape in the back of the ambo. Here we are, guys, talking about AMS, altered mental status patients, and violent patients and suicidal patients. Welcome aboard. This is Andrew with Utah's and America's Paramedic. Here to talk to you guys about AMS. Let's get into it. All right, so we're going to talk about altered mental status patients. So you guys are alone in the back of an ambulance. Your partner is driving. True story, had this happen. We're going down a road, and all of a sudden the patient starts going crazy. Now, if you're BLS, you're like, great, what do I do? Restraints, right? But what if you're ALS? You have chemical restraints, which are wonderful, right? So we want to make sure we discuss things like chemical restraints, what our doses are, okay, and all of the above. So let's get in and start taking it from a basic level. Now remember, if you start having a suicidal ideations patient that is start getting violent with you or violent just in general or says they're going to get violent, you have to make sure your safety is paramount and your safety is number one. Now remember, we are not cops. Okay, we pink sheet, white sheet, blue sheet, all the sheets, right? Holy sheet. However, we want to make sure that we do not ever transport a patient or try to arrest a patient. We are not cops. We have no right to stop their civil liberties. We have zero rights to take their constitutional freedoms away. That is all a law enforcement and cops job. Okay, so what a cop does, they can do that based off evidence, probable cause, reasonable suspicion, and all of the fun things. That is not our job. That's a cop's job, right? We are not cops as much as, everybody wants to be a cop, including firefighters, but we are not a cop, right? So our job simply is to transport once the arrest has actually been made by the law enforcement officer. Now you're like, arrest? Are they under arrest? Technically, yes, they are under arrest. However, they are taken under arrest to a hospital for their own good since they want to be a threat to themselves or others, okay? Now, your safety is paramount. So at what point when you're sitting there talking to a suspect, going back and forth and trying to calm him down and please, sir, calm down, and please, sir, calm down, and please, sir, calm down, at what point do you actually go hands-on with this patient, right? Well, that's up to you to decide using all of the basics, and hopefully your instructor has done a good job at teaching you guys at what point when to go hands-on, okay? And if you don't know, you'll know when you do it, trust me. So when it's time to go hands-on, you go hands-on. Remember, one up, one down. You never go both up, never go both down. You always go one up, one down, all right? So you restrain one up, one down, but the biggest thing, always check PMS, CMS before and after restraints are applied. Make sure you check PMS, CMS, okay? Every 5 minutes to make sure that it's not too tight, not cutting off circulation, because remember, we do no harm, okay? So always make sure restraints are one up, one down, and always checked every 5 minutes, especially before and after application. Now, here's the kicker. If you're ALS, you get a whole nother level of restraints above that called chemical restraints. Chemical restraints are things like Versed, Ativan, okay, Valium, Benadryl, Haldol, all the fun things, ketamine. Ketamine's a great one. Let's go back and talk about doses. Our doses are 2.5 to 5 for all midazolam Versed, 1 to 2 milligrams for Ativan, and remember 1 to 2 milligrams per kilogram, up to 5 milligrams per kilogram for straight up sedation of ketamine. All right, 25 to 50 of Benadryl and 5 of Haldol. All right, you guys ready for that? Let's go. Now that we're done talking about that, let's just say, make sure you guys are safe during your transports. And as always, keep your head on a swivel and pay attention to good patient care and document. Merca out.